Morning, everyone. Thank you for joining me here today. I want to first of all say a special best wishes to my friend Steve McNeil as he departs his role as Premier of Nova Scotia. He was a tremendous Premier, not only during COVID but before, and I know that Nova Scotians are thankful for his service to them. I also wanted to say to Premier-designate Rankin that he has big shoes to fill, literally, and that I'll look forward to working with him as well. And Steve, you don't have to go into work next week, so stay the blazes home. Today I want to talk to you about our number one limiting factor in protecting Manitobans from this deadly virus, and that's the availability of vaccines. We need vaccines. We need vaccines to protect ourselves, to protect our families, to protect our businesses and our communities, our healthcare system and our economy. But when it comes to getting vaccines, we are ranking behind dozens of other countries. The federal government's job, and it's a big job, is to get vaccines for Canadians, and the province's job is to get vaccines to Canadians. And this has been designated as our responsibility, but if we can't do our job, then all Canadians suffer as a consequence. And we can't do our job if the federal government doesn't do its job. The lack of vaccines means that too many Canadians will contract COVID. They'll also be at more risk of contracting COVID variants, and too many Canadians will become ill, and too many Canadians will lose their lives. The federal government made a choice early on, and they had their reasons for it, and the choice was to block provinces from being able to buy vaccines. We have tried. We have never stopped trying, but we've been refused. The door was slammed in our face repeatedly, and I know other provinces have tried as well. The federal government chose to place their orders exclusively with non-Canadian countries. I can't, none of us can speak with accuracy to the contracts that they signed. We haven't seen them, but we know that here in Canada, we are waiting for vaccines. The U.S., with its previous president, said America first, and its present president says the same thing when it comes to vaccines and other things. European and Asian countries are expecting that they have home field advantage as well, and meanwhile here in Canada, we wait. The British government addressed the need some months ago for domestic vaccine production and orders earlier on. They are now estimated to be able to produce nearly 1 billion doses of COVID-19 vaccine just some months later. And the UK is producing and administering their vaccines and is one of the world leaders in making vaccines available to their citizens. Meanwhile, here in Canada, we wait. The federal government scrambled to purchase and place orders from everywhere they could, and I am grateful to them for doing that, and I am grateful to the federal government for the vaccines that we have received here in Manitoba. But the approach they have taken means that when it comes to getting vaccinated against COVID, Canada First is in danger of becoming Canada Last. As a government, we must do everything we can to protect Manitobans from this deadly virus, and we will do everything we can to protect Manitobans from this deadly virus. I've said it before and I'll say it again, this pandemic is a marathon. It is not a sprint. We needed vaccines last year. We need vaccines this year. We will need vaccines in the years to come as well. And that means that we must take every possible step to ensure that Manitobans and Canadians get the vaccines they need. We have learned the hard way that we cannot rely on only one source of supply, and that supply is somewhere outside of Canada. So today I am pleased to announce that here in Manitoba we are investing in a Made in Canada solution. I'm pleased to announce today that we have entered into a preliminary agreement with Providence Therapeutics to purchase 2 million doses of a new mRNA COVID-19 vaccine that will be manufactured here in Manitoba. Our agreement with Providence will ensure that Manitoba has the right to receive the first doses of COVID-19 vaccine developed, and that delivery will be expected, depending on federal approval, later this year. And we will receive those doses, and Manitobans who are the country's best shoppers would want to know this, at the lowest available price. We have secured a best price guarantee from Providence, and we are pleased to say that we believe that price will be economical and achievable. But the most important thing is that we get the vaccines, isn't it? And as Premier of Manitoba, I'm particularly pleased to say that Providence has chosen to partner with Emergent Biosolutions. That's a leading manufacturing company with a facility located in Winnipeg. This is good news, I think, and a good indication of where we need to go as a country as well. With today's announcement, we're taking a big step, but it's a much-needed step to creating a secure, stable supply of Canadian-made COVID vaccines. But today's announcement's about much more than Manitoba. It's about Canada, and it's about bringing greater peace of mind to Canadians by giving them COVID vaccination insurance. At the end of the day, this is really what this is about. It's about that sense of security that you get when you're insured properly. And insurance against COVID is important. It's insurance against sickness. It's insurance potentially against death, too. Insurance against COVID closures, insurance against COVID economic loss, insurance against another pandemic, insurance against another year like the one we just went through. I have invited other premiers and the Prime Minister to join with us in this effort. I have written to every premier telling them about today's announcement and inviting them to partner with the company of their choice that may be available to assist us in building a Canadian-made solution against COVID, not just for today, but for tomorrow as well. After all, Canadians are best served when we work together for one another. Thank you. I look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this morning. Up first, from CTV Winnipeg, Michael.
Yes, hello, Premier Pallister. Can you touch a little bit more on the timeline we would expect to these vaccines to actually go into the arms of Manitobans? How long is the process going to take to build a site, get the vaccines, and administer them?
Well, the manufacturing facilities here, the record of the company, you can learn more about directly from the company. I'll only say that this is right now the only company, we believe the only company in Canada that a provincial government could deal with in developing and producing an mRNA vaccine. And I'm not a scientist, but I understand that this is a vaccine that would allow you to be able to produce your own cure within your own body, and that is a solution we all want to be able to do when it comes to COVID. We have a preliminary agreement today, but the vaccine's approval timeline will be determined in part by Ottawa's approval process. The company's well along in its tests and testing capabilities, and so we're hopeful of approval and availability by this fall, as early as this fall.
Thank you. My second question has to do with rapid COVID-19 tests provided to the province. And in Manitoba, I think we've only used about 1.5% of all the tests that were provided. Is there a reason for that? Why are we using these rapid tests?
Yeah, they weren't very reliable, quite frankly, the federal tests, so we're not using them much. There are some uses that we can put them to, but they're very limited. Instead, we researched and found better testing machinery, I'll call it that, equipment. We're using, for rapid testing, we're using a high-risk B cubes, or it's sometimes known as a high-risk songbird. We've invested close to $50 million in that equipment. We're deploying it. We have 50 machines and numerous additional testing capabilities. It's being deployed for rapid testing, for example, right now for our frontline staff in our schools. Our educators, our teachers can now get results rapidly back, and then if they're not ill, they can go back and they can work with the children they love to teach.
From City News, Stephanie.
Hi, Premier. I just wondered if you could elaborate more on this particular mRNA vaccine. I know it's still early, but in your research on it, how effective is it expected to be, stuff like that?
Yeah, it's expected to be as effective as Moderna and Pfizer vaccines, but of course that's what the testing process is about. The federal government has sped up its approval of Pfizer, Moderna, and others through its offices, and we would expect that they would do the same for a Canadian-produced vaccine.
Okay, and just to clarify how the structure of this agreement works, Manitoba doesn't dole out money until the doses arrive. Is that correct? And how much would this cost at the end of the day?
Yeah, it's a schedule. We'll release the details of the contract when it's finalized. We've reached a settlement, but the contract isn't finalized yet, so I'm hesitant to give you too much in advance of that finalization. I'll only say this, 20% down, 40% on approval by Health Canada, 40% on delivery of the final vaccine orders.
From the Winnipeg Free Press, Larry.
Premier, are you satisfied that the province is doing everything it can to track COVID-19 variants in a timely way? Are you using the full available resources of the University of Manitoba, for instance, to carry out the necessary tests?
Yeah, we appreciate that our health leadership has done a tremendous job in preparing us and protecting us through this entire pandemic. And I think they deserve better than a headline that uses the word insane in it in your paper.
Can you assure Manitobans that the government is willing to spend the necessary funds and that it's not a limiting factor in the swift detection of variants?
Absolutely, I can assure Manitobans of that. And I can go further and say that we have been assured by our health officials, who we place great trust in and have great respect for, that they began testing for variants months ago, and that their approach that they have taken is always subject to review and revision, but that cost is not a factor in any of their evaluative decision making.
From Global News, Joe.
Hi, good morning, Mr. Premier. I am wondering if any of the provinces or the federal government have responded to you yet on the announcement.
Well, they better not have. I just mailed a letter this morning, so Canada Post I don't think is that good. They're good. I'm not complaining, but they're not that good. No, we've talked. Premiers have talked. We talk every week, and we've talked about this, and I think the premiers are in broad agreement that domestic supply has to be boosted up. And so I'm hopeful that we can actually take steps to do that, because remember, we're in a pandemic now, but we've got these variants coming up. We're going to need science to evolve quickly. We're going to need it to make sure we have vaccines that are produced here in Canada, I think, based on the lack of available supply from other countries. Every other country seems to want its home field advantage. I just want a Canadian home field advantage for us.
And kind of doing this on your own, trying to secure vaccines instead of going through the federal government, could this maybe turn into provinces like having to compete against one another for getting their own vaccines?
Look, you got to understand something. The federal government took away our right to buy vaccines by placing blocks on our ability to do that. We've been knocking on doors for months now. And the fact of the matter is that health care is a constitutional responsibility of the provinces. I'm not knocking the federal government. They'll have their own reasons why they wanted to centralize the procurement of vaccines. But this is about provinces being able to secure necessary vaccines for the people that live in their provinces. And for me, I want Manitobans to get vaccines, and I'd rather they got them sooner rather than later. And so that's why we're reaching out. We've been reaching out consistently for a long time now. And I'm really pleased to say to Manitobans that whether it's this pandemic, look, if the feds deliver all the vaccines that they say they're going to deliver, then this is important for future pandemic responses. Hopefully it isn't needed. Hopefully everybody gets vaccinated by September, I think the Prime Minister has said. If not, this is insurance. And it's important to have insurance, especially when it's a life-threatening situation, I think.
From the Brandon Sun, Colin.
Morning, Premier. I know with some of the vaccines, like the Pfizer vaccine, there are very stringent cold chain requirements. Do you know if this vaccine from Providence will be more like the Pfizer in terms of management, or more like the Moderna vaccine?
Yeah, Colin, a really good question. My understanding, and you'll get this better from the companies themselves, the company itself, Providence. But my understanding is this is a much more like Moderna type of vaccine that has, we have real reason to be optimistic that this is going to be not only an effective vaccine, but an easier vaccine to get to people effectively. And that's really important in a province like Manitoba's with a lot of physical space to cover and, a population that's widely dispersed outside of Winnipeg.
And in terms of cost, I know you said the contract is still being finalized, but is arranging to create your own vaccine more expensive than doing it through the federal government, or less expensive? Do you know?
Well, I don't know because I haven't seen the federal contracts, Colin. I can only say from what we have heard through sources that wish to remain anonymous in Ottawa, that we'll have a better price for this vaccine than the federal government is paying Pfizer or Moderna. And in addition, if they should negotiate, if this company should be negotiating on bigger deals with larger provinces than ours, and they're able to get the price down, we get that lower price. So we have secured that guarantee. The most important issue, frankly, though, is making sure we have vaccines, that they're ready, that they're here when we want them to protect our people, now and in the future.
From the Winnipeg Sun, Scott.
Hi, good morning, Premier. Wondering your thoughts on the province's plan, which apparently now has been halted, on vaccinating inmates in Brandon Correctional before, let's say, assisted living facilities or other areas of, people that are 70 or older, people that are more at risk, I suppose, than inmates.
Yeah, well, I've been consistent in this. I'm placing my trust in our health officials, and their call is the call that's going to go, not the politicians. If it was a political call alone, we know that the public might not generally care too much about inmates in prisons, but the fact is that we got to do it on the basis of health and the danger to people. And so I'll leave the prioritization issue to them. I don't think there's anybody sitting up in the stands that truly wants to get on the ice and make those decisions about who's getting it when. Let's leave it to the health officials. They're the experts on this stuff.
Thanks for that. It seems like in what you said, these vaccines that you're pursuing are insurance vaccines. So, but you said you've had to put is 50% down or 40% down already. So, and you talked about a little bit about future pandemics. Is there any understanding that these vaccines would have any effectiveness against a future pandemic?
Sure. Well, you're entering into a partnership with a company that's got a history of being able to produce very effective vaccines, that is in Canada, that has operations around the country, that has manufacturing capability in the city of Winnipeg. And if we need vaccines, and we do, then we need to start dealing with our own people. When the cavalry, we all want the vaccine cavalry come spiraling over the hill. But frankly, in the long term, they aren't going to come over if they're wearing uniforms from some other country on the other side of the ocean, are they? So we'd like them to have a maple leaf on their tunic. And if they have that, then the chances are pretty good that Canada's going to get some service out of the deal. So that's what we're trying to establish here. Domestic supply, domestic production is a critical aspect of securing better health protection for Canadians going forward, whether it's this pandemic, whether it's consequential challenges we face with some of the byproducts of this pandemic, or whether it's next year's pandemic. I think it's good that we get our own house in order here. You can't help the needy of the world if you're one yourself. And, we can't go on taking back from third world countries what we promised to help them and act like we're doing the world a favor. We've got to help ourselves. And in doing that, we'll be able to help other people too.
From CBC Radio Canada, Matthew.
Hi, Premier. Do you think Ottawa will deliver enough vaccine to you for your vaccination plan in April of 20,000 doses per day?
One can only hope, Matthew. That's what we're doing. We're forced to place our faith in Ottawa in respect of availability of vaccines. Their job is to get it to us. Our job is to get it into your arm. But this announcement today is about making sure that as we go forward, we're able to do that effectively here in Canada and not have to wait and be at the whims of whatever other suppliers want to do in their own country first.
Thank you. I don't have a follow-up question.
Thank you, Matthew.
From CBC Manitoba, Bart.
Hi, Mr. Premier.
Hi, Bart.
You described this as insurance, and presumably, it will take months and months for this to be approved. What happens if larger supplies of Pfizer-BioNTech Moderna vaccine do arrive in Manitoba? And what will you do with the quantities that you will be receiving of this vaccine in addition to larger quantities once they get here?
Well, we have, and you'll see it when we're able to give you, Bartley, and our plan is to give you all the details of our finalized agreement. You'll see that we've secured supply availability when we need it. So if, in answer to your question, if what we all hope happens, and we get all the vaccine we need and everybody's hunky-dory happy, well, we might need vaccines next year. So we'll have a deal. We'll be able to secure them at a very good price for Manitobans when we need them. Because I don't think we can count on the federal government forever to be organizing vaccine distribution in our country. That isn't what the Constitution provides for, and clearly there are challenges with the way that has rolled out.
What concerns do you have about the potential of federal rollbacks of distribution of the other vaccines because of this, or some form of diplomatic road because you folks have gone out and arranged your own purchases when they wanted to be the purchaser?
Well, I don't think that, I'll let the Prime Minister speak to this. I don't think the reason the federal government wanted to be the sole purchaser was just so they could get the credit. I think the federal government had reasons, and they can give you those reasons for why they wanted to be the purchaser. But surely they wouldn't stand in the way of provinces who have, throughout our history, been responsible for delivering health care, getting involved in the delivery of health care. And so, no, I don't anticipate that there'd be any kind of petulance on the part of the Prime Minister because the Premier was showing some initiative and trying to get some vaccines for the people in their province.
Our final reporter this morning, Mr. Premier, from the Canadian Press, Steve.
Good morning, Premier. You mentioned that some bigger provinces theoretically might be able to drive down the price. And is that not the rationale for a national approach, in that a market of 34 million people might be able to generate a lower price than a few provinces going off on their own?
Yeah, how's that working for you so far, Steve? That might be the rationale, but it's not getting us vaccine production in Canada. So that's what we're about. We're trying to initiate a project that we believe will benefit Manitobans in the short term, that will benefit Canada in the longer term. And I think there'll be many other premiers who would say that's a great idea, and I hope that they will join in as well, so that we don't ever run into a problem again where we are going to take vaccines away from Sierra Leone for ourselves because we haven't got enough produced here. Or that we have to go to India, an underdeveloped country, an underdeveloped nation, and say, hey, could you help us out? Cap in hand, banging a tin cup. I don't think any Canadian wants to see that happen ever again. So this is the right direction for us to go as a country. Let's get in a position where we have domestic manufacturing capability here for vaccines in the future.
And if the distribution of Pfizer and Moderna ramps up as projected, and you don't need these new vaccines in the short term, do you forego money? Is there a deposit that you will forego?
You'll see the agreement, Steve, but we've negotiated, I think, a very good deal in terms of price, in terms of immediate availability if needed, and in terms of ongoing supply, which is very important because remember that this vaccine isn't going to go away. It's a marathon. And so next year we'll need more vaccines. The year after we'll need more vaccines. Perhaps there'll be another pandemic. We all hope not. But when there is, having that built-in partnership, that preferred client relationship with a provider and manufacturer here in Canada is a very, very beneficial thing for us as Manitobans, but I think also for Canadians. I want to say thanks to everybody. If I could just take a quick second to remind everybody, follow those fundamentals. Closed contact settings, avoid them. Crowded spaces, avoid them. Crowded places, avoid them. Wash your hands, stay home when you're sick. Stay home when any member of your family is sick. Wear a mask, limit your close contacts, stay positive, and a special 65th birthday wish to Bev Duas, 40 plus years of frontline nurse. You're gorgeous, Bev. We love you. Congratulations on your 65th birthday. All the best.